Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today, the topic is the Senate GOP healthcare bill, recently introduced. We're going to start by asking, what is it? Well, this is the Senate's version of the bill to repeal and replace the Affordable Care Act. You might be familiar with what the House did back in May. They introduced some legislation. It was highly criticized. The Congressional Budget Office put out a report that said how many people would be impacted by that bill. And the Senate said, we're going to write our own version. We're not just going to make some small tweaks to the House version. We'll talk about it in a minute if they accomplish that objective. But let's give a little bit more background before we do that. It's called the Better Care Reconciliation Act. Reconciliation because it's a nod to the type of process the Senate is using to pass this legislation. Now, it's been introduced, it has not been voted on yet. But by using budget reconciliation as the procedure to introduce this bill, that means they only need a simple majority to pass. There's no option for Democrats to filibuster. It's a way to get things through quite quickly. It also has its limitations, and that's something that might come up as a concern based on the way that this bill was actually written. Some of the language of the bill kind of exceeds what is allowable in a budget reconciliation type of bill. Overall, what's it doing? It's cutting Medicaid. It's taken a big shot at the Medicaid population, introducing things like per capita caps, like we saw in the House version, getting rid of things like the individual mandate, putting an end to Medicaid expansion, phasing that out over time, scrapping the tax credits that are there, and any tax that would help pay for the Affordable Care Act that exists now would be re-envisioned. And instead, we would have a new system of tax credits. And the last provision, giving states flexibility to drop essential health benefits, something we saw before. That looks a lot like getting rid of the expensive care, maternity care, emergency services, and mental health care benefits. Curious why that would be a priority at the time when they're also trying to put extra money towards the opioid epidemic in this bill at the same time. Is it similar to the House GOP bill? Even though they said they were going to scrap that bill and start over, there's actually a lot that's quite similar. But don't get caught up comparing the House version to the Senate version. A lot of health policy experts out there are saying we really should be comparing the Senate version to what is going on with the Affordable Care Act and what the goals of the Affordable Care Act were originally. And you can see there where the priorities have just shifted. There's a big return to the idea of states' rights, giving states back the ability to regulate their own insurance markets. Some of that delegation had gone to the feds to try to create things like uniform systems and applications for benefits, essential health benefits, determining what benchmark plans would look like. This Senate bill gets rid of that, returns to the bad old days of private insurance. Like we said, it brings back things like per capita caps, phases out the Medicaid expansion in some states, and then has a little renegotiation for some of those states that did not expand Medicaid, like the state of Wisconsin. It would leave, and this is some of the quotes that are coming out of some of the health policy experts, leave more of the middle class without affordable coverage. The biggest impact would be felt by the lowest income and now the middle income families, more so than what the House version of the American Health Care Act was proposing. Overall, it also allows less generous plans to be what are called those benchmark plans. You'll remember out of the Affordable Care Act that every state has to select what's called the benchmark plan, kind of the middle of the road average plan that covers all essential health benefits, is a silver tier level plan. It's kind of that middle of the road of which all actuarial values and other plans are kind of based. Well, what this Senate bill does is it allows a really much worse plan serve as your benchmark plan. And don't forget that it also lets you not have to conform to the individual mandate anyway. So it's really paring back the priorities of making sure that people can have healthcare coverage and services that cover the broad spectrum of need, and it slims that way down. Concerns, there are lots. Written in complete secrecy. This, the media has been quite vocal about, and luckily so. This is a bill that was written by a committee inside the Senate, a selection of about 20 or so senators that wrote the bill. They did not share drafts. They did not share conversation. There was no open discussion, and there certainly wasn't a public hearing. There is not the intent to call for a public hearing or an open hearing before the Senate is scheduled to vote, and the Senate Majority Leader Mitch McConnell would like that vote to happen before their July 4th holiday. Like I said before, it returns to the pre-Affordable Care Act days of states setting their own insurance regulation. As we see, this is an option to go back to states' rights and deregulation, some of the talking points that we've seen coming out of the Senate over time. And overall, it deepens long-term Medicaid cuts. we see a dramatic change in how Medicaid is being operated. And this goes to those talking points that want to shrink the size of government, the Republican talking point of shrinking the size of government and shrinking people's dependence on entitlement programs like Medicaid. It essentially gets rid of the Medicaid entitlement. And some senators have been tweeting this morning that they want to encourage people to have equal opportunity to buy their care in the private market instead of rely on Medicaid. Well, that's a nice talking point, but that's hard to balance when you see who the Medicaid population is. 40% are children. The other largest group of folks taking advantage of Medicare are seniors on Medicaid, are seniors in long-term care. This ties per capita caps to the consumer price index. That's different than the House version of the bill. That means that funding for Medicaid over time would not increase as much as if you were using the healthcare index, which grows a little bit more aggressively, which is one of the reasons why we say it provides deeper cuts to the Medicaid program. It's not keeping up with inflation the same way, which means that states would be given Medicaid money to administer their program, and that pot of money would actually be shrinking over time, which means that states would either have to cut eligibility for Medicaid or cut the benefits and services they provide. You know, this overall, the talking point was this is a way to get rid of some of the stability problems in the marketplace and to get rid of some of the insurance disruptions that insurance companies were complaining about. Every health policy expert that's commenting largely on this bill since its release has said the effect is going to be the exact opposite. This type of legislation, written the way it is going to increase disruptions in the marketplace, and it's actually going to have the adverse effect of reducing costs, which was one of the goals that they had set going in. We're going to see higher premiums, higher deductibles, and declining competition in the marketplace because of this type of bill. So what's next? I mean, as we said, it was introduced, it's not law. The House introduced their version. The Senate said they wanted to write their own, so they did. They introduced it. There's got to be some sort of process where the Senate votes. They want to vote before the 4th of July. It's looking like that vote either might not happen or there might be enough senators that don't want to vote for it, so it wouldn't pass. Again, they need a simple majority. So as many as 2 Republicans don't like it, that would not pass. Like I said before, they are using a budget reconciliation process to do this, so they only need a simple majority, which also means that there are no filibuster options. So if they do call a vote, it will go to a vote. Mitch McConnell, like we said, wants to do this quickly, but one thing hasn't come back yet, and that's that Congressional Budget Office report on the impact, the cost and the impact of this legislation. You might recall when the House introduced their version of the bill, they also did not wait for a Congressional Budget Office report. That report didn't come for as many as 3 weeks after the House voted on that bill. That report was very damaging. It said that many tens of millions of people will lose their health care coverage, most of them out of the Medicaid market, and the cost to families and to the market would just be exorbitant. It also talked about the restricting of money that was available for Medicaid programs and health coverage overall. We're waiting to see what the Congressional Budget Office would think about the Senate version of the bill, and that's not expected anytime soon. You can read the Senate bill, the Better Care Reconciliation Act. You can read this in its entirety. We have a link to that on our website and on that information button you see at the bottom of your screen. There's also been extensive media coverage. The nice thing about the media coverage is they're giving a good summary of what's in the bill. They're also reminding people that this was not a transparent process and encouraging people to contact their own elected officials and weigh in on whether or not they support this legislation or not. There's a big public effort to make sure that your voice is heard on what happens to the future of Medicaid in the state and what happens to the future of private insurance. And you have the opportunity to tell your story. Whether it's your Affordable Care Act story, it's your Medicaid story, or it's the story of how it's important to make sure that essential health benefits and people with pre-existing conditions are protected. You can tell that story to us, you can tell it to your elected official, you can visit us at healthwatchwisconsin.org or send us an email. Thanks for joining us.